Hello everyone, welcome back to another session in dentistry and more. Today's session is about brushing technique demonstration. So I'll be demonstrating you all the techniques of brushing using a tooth model and a toothbrush. So there are various techniques which can be used to brush your teeth, such as bars or modified bars technique, Stillman or modified Stillman technique, Charters technique, Phones technique, scrub technique, physiological method. So many techniques are there. We'll cover it one by one. Mostly people use just the horizontal technique, but it is the most detrimental technique for our teeth. So I'll give you the explanation for each technique and what are the advantages and disadvantages. So we'll start with one by one. So before moving on, I want to tell you tree angulation, how the bristles are placed on the tooth surface. Okay, so this is a 90-degree angulation. Okay, 90-degree angulation. This is 0-degree angulation. Again, this is 0-degree angulation. But this is 45-degree angulation to the tooth surface. On the lower teeth, it will be like this, 45-degree. This is 90-degree. This is 0-degree. And this is 45-degree to the tooth surface. Okay, so now we'll start with the bars technique or modified bars technique, which is the most accepted brushing technique or ideal brushing technique, which is recommended by ADA, American Dental Association. So angulation of bars technique is 45-degree to the tooth surface. You need to keep 45-degree to the tooth surface, slightly push the bristles into the interdental area. So this is the interdental area, the space between the teeth. So slightly push it. So it should be, the pressure should be very minimal. Slightly push it. Then try to engage it there. Do a vibratory stroke and do a sweeping action downward. Okay, engage it, do a vibratory, and then do the sweeping action downward. So the advantages is it removes the interdental debris. It removes the debris which is present within the gingival sulcus, that is the area between the tooth and gingiva or the gums, and it massages gingiva and it cleans the teeth. So similarly, you can follow all the teeth, 2 or 3 teeth at a time. Just do the vibratory motion back and forth, then do the sweeping action. Actually, this sweeping action is not there in bars technique, which comes in modified bars technique. This is just bars technique. Okay, but when we have an additional occlusal sweeping or the sweeping towards downward, it becomes modified bars technique. So you can follow all the segment. Always overlap the teeth so that you don't miss any part of the teeth without brushing. Make sure that all the teeth are clean, so you can just follow it. Similarly, you can follow the same pattern in lower teeth. You can just hold it 45-degree, engage the bristles into sulcus and indent proximal area, do the vibratory motion or back and forth motion, do the occlusal sweeping. So it will remove the food debris which is present here, which is present in the gingival sulcus. And the inside area also you can do it like this, keep at 45-degree to tooth surface and do the occlusal sweeping. And here also can keep at this angulation and do the similar motion. The upper teeth also we follow the same method, and there will be always occlusal cleaning. So occlusal cleaning is just perpendicular to the occlusal surface, irrespective of the method we use. Modified bars technique is not at all an easy technique. It is a very difficult one for a common man to follow. So first thing a dentist should do is to demonstrate the technique in a model using a toothbrush, then to ask the patient to repeat the same in the model, then ask the patient to do the technique in his own mouth using a separate toothbrush. So once he is okay with the technique, the rest thing he can manage it at home. Whereas the Stillman method is slightly different from bars technique. Okay, so in bars technique we engage the bristles into gingival sulcus with a 45-degree. The bristles will be entering into the gingival sulcus. But in Stillman method, the angulation is same, that is a 45-degree, but we will not insert the bristles into the gingival sulcus. We keep the bristles partly on the gums and partly on the teeth. Then we'll do the same action. So it is basically for people with gingival recession, for more cleansing of those receded areas. In gingival, sulcus penetration is ideal method, that is using in modified bars technique, but here the penetration of bristles into the gingival sulcus is not there. And rest everything is same. You need to do a 20 strokes at a time and 3 to 4 teeth or 2 teeth, and always overlap the teeth. Then do the occlusal sweeping action. That will become modified Stillman. Without sweeping action, it will be just Stillman method. And now we have the commonly used horizontal technique or the scrub technique. That is what 90% of the people uses. Just scrub it horizontally. So always and applying a very hard pressure. So what happens is, this is very detrimental to our teeth, because for a right-handed person, the left side of the teeth, especially this part of the teeth, there will be tooth abrasion, that is the enamel will be lost, and there will be creation of V-shaped notch. So enamel will be lost from this part, because the right-handed person tend to apply more force on the left side, that is the upper left side. So he applies more pressure here, and there will be loss of enamel from this cervical part, which is known as wasting disease or tooth abrasion. Vice versa for the left-handed person, there will be cervical abrasion, that is tooth abrasion on the right upper side of the posterior teeth. So that is the most commonly used, the horizontal scrub technique. Now we have the Charters technique. Charters technique is exactly opposite to the Bass method. Here we kept 45-degree apically. This is apex, this is crown, this is towards the tooth, that is known as coronal, towards the gums, which is known as apical. So this is 45-degree apically, but in Charters technique we keep exactly opposite, 45-degree to coronal side. This is basically we use people with orthodontic brackets who underwent the periodontal surgery in order not to disturb the gums much. So the same method we use, Charters technique, back and forth motion, just cleaning the crowns and not much cleaning the cervical or gum area. That is a Charters method. Now we have the Child's method. Do the circles. This is how a child should brush his or her teeth. Just make circles, because all this angulation he or she can't do. So just teach him to do circular motion, simple circles over the teeth. This is Fawn's technique, or just circle technique or circular technique. Now we have the Leonards technique. Leonards technique is nothing but 90-degree. So we keep this at 90-degree to tooth surface. Okay, we just do this. This is Leonards technique. We keep it perpendicular. We just do this and clean the teeth. It is not done together. After the upper teeth, we do the lower teeth. Okay, this is Leonards technique, 90-degree. And lastly, the Smith technique or physiological technique. So that is just like keeping it parallel to tooth surface or long axis of the tooth. So in Bass technique and Stillman technique, we kept our tooth bristles at 45-degree. In Charters, we kept 45-degree towards the crown. In Leonards technique and horizontal technique, we kept 90-degree. Now is a 0-degree. Okay, for upper teeth, we just keep the bristles here and not making any angulation. We just do this on lower teeth. Why it is known as physiological technique? Because we have the buccal mucosa here and the labial mucosa, that is the cheeks and lips, are always in contact with this teeth, and it does the massage or it cleanses the teeth. So it is acting on it parallelly. So that action is mimicking. Okay, that is why it is known as physiological technique. That is a 0-degree angulation to tooth surface. So that is all about brushing techniques. So we learned the modified Bars technique, that is the most ideal one. That is the bars technique along with the occlusal sweeping. Then Stillman technique, which is used in recession, that is gingival sulcus entering is not there, partly it kept on the gums and partly on the teeth. Okay, then the Fons technique, that is child's technique, just circular motion, and the commonly used horizontal scrub technique. But the problem with the horizontal scrubbing is the one thing I told you, that is a tooth abrasion, enamel loss. Another thing is when there is an interproximal debris or the food debris are here, we are just pushing it inward. Okay, in bars technique we are seeing it is removing it. Now we are pushing it more inward, so that again causes gum problems. Now we learned Leonards technique, that is perpendicular. We do separately on maxilla or the upper or lower teeth, perpendicular 90-degree angulation. And lastly the Smith or physiological technique, which is 0 degree, just like how the labial mucosa or buccal mucosa cleanse the teeth. So I'll come up with another demonstration video in dentistry and more. Thank you.